Hello, my name is Jennifer Gentry and I am a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a SCAT5 concussion assessment. So, first of all, I'm going to get the athlete's name and date of birth and address and personal information and such. And then I'm going to move on to the immediate or on the field assessment, which step one would be to check for any red flags. And the red flags include neck pain or tenderness, seizure or convulsion, loss of consciousness, double vision, deteriorating conscious state, weakness or tingling, burning in arms or legs, vomiting, severe or increasing headache, and increasingly restless, agitated, or combative. And then we move on to step number two, which are observable signs. And so we're going to check for the player laying motionless on the playing surface. We're going to check for balance or gait difficulties, checking for disorientation or confusion or an inability to respond appropriately to questions, blank or vacant look, and facial injury after head trauma. And next we would move on to memory assessment or the MADIC questions. And so I'm just going to ask the athlete some of these questions and you're going to mark it with a yes or a no. And so what venue are we at today?
Jenny's house.
Alrighty. And which half is it now?
Second half.
It is. And who scored last in this match?
Sierra did.
Sierra did score last, you're
Sierra
right.
did.
What team did you play last week or last game?
Brianna's team.
Brianna's team.
Mm-hmm.
Did your team win that game?
We did.
We did. And then, so after we move on from the memory questions, we're going to go to the step 4, which is the Glasgow Coma Scale, and that is a series of it's eye response and verbal response and motor response, and we total up those, and we add all those up, and it's things such as whether there's no eye-opening in response to pain, eye-opening to speech, eye-opening spontaneously, but she is awake and alert, so she definitely has her eyes open. And then, so we go through all that and add all that up, and then we're going to move on to cervical spine assessment. And does the athlete report that their neck is pain-free at rest? Do you have pain in your neck right now at rest? No? That is good. If there's no neck pain at rest, do you have full range of active pain-free movement? Can you bring your chin down to your chest and look back all the way and bring your ear to your shoulder and bring your other ear to your shoulder and then look to the right and look to the left? Does any of that hurt you?
No.
Perfect. And is limb strength and sensation normal? So then I would go through and I would do my manual muscle testing and I would do the myotones. And in a patient who is not lucid or fully conscious, a cervical spine injury should always be assumed until proven otherwise. So moving on to, this would be in the office or the off the field assessment. Step 1 is the athlete's background. So all those things such as the sport, team, school, the date and time of injury, age, gender, dominant hand, how many concussions has the athlete had, and when was the most recent concussion, how long was their recovery time. And then we would ask, have you ever been hospitalized for a head injury?
No.
No? Have you been diagnosed or treated for headache disorder or migraines?
No.
What about diagnosed with a learning disability or dyslexia?
No.
Diagnosed with ADD or ADHD?
No.
Have you ever been diagnosed with depression, anxiety, or other psychiatric disorders?
No.
Are you on any current medications? If so, please list.
No.
Alrighty. And then, so step 2 of the off-the-field assessment is the symptom evaluation. And so I would go through and I would ask her all these symptoms and I would ask her to rate them on a scale of 0 to 6, 0 being none and 6 being the most severe. And those are all the symptoms, such as a few of those include headache, pressure in the head, neck pain, nausea, vomiting, dizziness, and then those all go on. And moving on to step number 3, which would be cognitive screening. And so I'm just going to ask you some questions and make sure you're properly oriented. Do you know what month it is today?
June
June. Do you know what the date is today?
the 2nd.
All right. And what day of the week is it?
It is Friday,
It is Friday. And do you know what year it is?
2017.
And do you know what time it is right now?
About 12:20ish.
All right, it is 12:19. Good guess, girl. And so those, she would get a total of 1 point for each of those she would get right. And then we're going to test the immediate memory. And so I'm going to list off a series of words, and I want you to repeat back to me as many of them as you can remember within any order that you can remember them.
Okay.
So finger, penny, blanket, lemon, insect.
Finger, penny, blanket, lemon, insect.
All right, one more time.
Finger, penny, blanket, lemon, insect.
One more time, 3 times.
Finger, penny, blanket, lemon, insect.
Perfect. So we do that 3 times to make sure they can do it 3 times in a row. And then we would go on and we would do a few more of those, and we would add up the score for that. And then we move on to the next immediate memory test, which is alternating 10 words list instead of 5 words. So I'm going to give you another list of words, and I want you to repeat them back to me in any order that you can remember them. Finger, penny, blanket, lemon, insect, candle, paper, sugar, sandwich, wagon.
Oh boy. Finger, penny, lemon, blanket, insect, wagon, sandwich.
Nice.
Was jacket somewhere in there?
No. Got
Nope.
3 more.
That's about it.
Alrighty, and so then I would read those off to her again and give her a second chance, and then if she didn't get that one, I would give her a third chance, and then we would move on to concentration, and so that would be saying the digits backwards. So I'm going to read you some numbers, and when I say them, you're going to repeat them to me backwards. So if I say 1, 2, 3, you'll say 3, 2, 1. All right? So 493,
394,
526,
625,
142,
421.
142.
142, 241.
All right, and then we would keep going and keep going and keep going with those until we got up to the highest list of numbers, which would be 7 numbers in a row. And then we would add those points up. And another one for concentration is, can you say the months of the year backwards? So starting with December and working your way.
November, October, September, August, July, June, May, April, March, February, January.
Nice! And so she would get the full points for that. And step 4 is the neurological screen. And so this would be, we would see if the patient could read out loud and follow instructions without difficulty. And does the patient have full range of pain-free passive cervical spine movement, which she had full active range of motion without pain, and so there's no need to do passive. And then without moving their head or neck, can the patient look side to side and up and down without double vision? And then can the patient perform the finger to nose coordination test normally? So keep your head in place and just move your eyes and look at my finger with your eyes. All right. Boop. Did you have any blurriness or double vision with that?
No.
Alrighty. And then can the patient perform tandem gait normally? So I'm going to have you stand up for me right here. And what we would do is, so I'm going to have you place one foot right in front of the other so that your heel is touching your other foot. And you can kind of hover your hands over me for if you need to. And then I would have her hold that for about 20 seconds. And then I would say to switch your feet so that the other foot is in the back. and hold that for 20 seconds. So we would have them hold that for about 20 seconds, and she seems good with that. And then moving on to more balanced examination. So the best testing would be the double leg stance, the single leg stance, and the tandem stance, which is what we just did. So in addition to the tandem stance, I would have her stand on one leg at a time as well. The next step would be the delayed recall, and this would be this delayed recall should be performed about 5 minutes after the end of the immediate recall section. And so I would ask her, can you remember any of the words that I read to you earlier? And as many as you can remember. Just tell me as many as you can remember.
Finger, penny, lemon, blanket, insect, sandwich, wagon. Yep, spat all out.
Alrighty, and so then I would write those down, and I would total those up, and I would write those points down. And then after that is our step 6, which is our decision-making process. And so that's writing down all of the points and going back and totaling everything up and writing it down in the chart and coming to the conclusion of whether or not the athlete has a concussion or not. And then we would sign and date, and it says, I am a physician or licensed healthcare professional, and I have personally administered or supervised the administration of this SCAT5, but I am a student. And so we would make sure a licensed athletic trainer would be doing this on a real athlete. And the scoring on the SCAT5 should not be used as a standalone method to diagnose concussion, measure recovery, or make decisions about an athlete's readiness to return to completion after concussion. So this is just a tool to aid in our decision-making process, and it should not be something that we put our full trust into, I guess, or our full decision-making process into. It should be a series of different things, such as knowing your athlete and other things like that, and impact tests. It goes into the battery of tests. And thank you for watching.